physician, welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in Shoreview, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimal health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Great to have you with us. Wherever you are, we're in Shoreview, Minnesota, the gateway to the north coast of the United States. And we're happy to have you with us. Great time. We've been doing a series on whiplash injuries, and if you haven't seen the first 4 programs, we'd invite you to go out on our website, which is www.housecalltv.org. We'll say that again. There it is, www.housecalltv.org. And if you're not interested in whiplash type injuries, spinal injuries, there is a complete alphabetical list of health problems from A to Z out there. So we invite you to go out there, and we're going to start today with my esteemed colleague, Dr. Richard William Jensen, and he's going to talk about the long-term effects of whiplash injuries.
Thank you, Dr. Lala. Well, looking at long-term injuries of whiplash injuries, first of all, we're going to look at the Journal of Bone and Joint Surgery. It's a British study that was done. The study involved 431 patients over a course of 10.8 years who had been involved in whiplash injuries. Now, the back injury symptoms that were found there was low backache. They also had abdominal pains. Thigh and leg and foot pains were also there, as well as edema or swelling. And in the female patients, there was menstrual irregularity as well. Dr. Lala, how about some of the long-term soft tissue injuries?
Some of the long-term soft tissue injuries involve 40% of those involved in whiplash injuries experience neck, lower back pains and problems 10.8 years post-accident. Simply means that if we look at the brain, spinal cord, brain is like an electrical generator, big computer up here. Spinal cord starts out at the foramen magnum, a hole in the base of our occipital bone here, called the medulla oblongata. Spinal cord goes all the way down. So it'd be like the main power line coming out of the power plant. Well, the spine has little holes in it called intervertebral foramina. And so nerves, arteries, and veins from the spinal cord pass out to all of our tissues. The spine then is like the switchboard of the nervous system. So if there's something wrong with the spine, a curve, subluxation, or bone out of alignment, then it's going to interfere with the normal function of those nerves, arteries, and veins. Therefore, if I have an injury up here, it can affect everything from head down through here. If I have an injury here, it's going to affect everything out here. If I have an injury in the lower back, it can affect my pelvis, pelvic organs, and all the way down to my toes. So, as we said, some of the long-term soft tissue injuries from whiplash injuries, 40% of those involved in whiplash injuries experience neck and lower back pains 10.8 years after the accident. Now, 12% under chiropractic care completely recovered, 28% had residual symptoms, 12% were severe. Older patients have a worse diagnosis or a worse prognosis. Now, symptoms 10 years post-accident consisted of, the percentage of them were 74% of people who had been involved in whiplash-type injuries had 74% had neck pain, 45% had paresthesia, that's sleepy, tingling, numbness in their hands, arms, or legs. 42% had lower back pain, 33% had headaches, and 19% experienced dizziness. 14% of those also involved auditory symptoms such as tinnitus, ringing in the ears, deafness, or loss of hearing acuity. 2% of dysphagia In other words, they didn't talk as normal as their tongue just didn't work as good as it should have. 12% had visual symptoms. Their eyes just didn't focus. They didn't see as good as they had prior to the accident. 12%, though, under care recovered completely. 28% had what are referred to as intrusive residual symptoms. That's not good. 12% of the persons had symptoms were severe. Now, how about seatbelts? The research also studied the use of seatbelts or not seatbelts. Seatbelts alone afforded no protection against hyperextension whiplash injuries. What is hyperextension? Hyperextension would be this way, hyperflexion is that way. So that means if a force comes from my rear, then the law of physics says I'm going to go, my spine is going to whip, not just in my head or neck, it's going to whip backwards and then forwards. So the seat belts in themselves did not prevent injuries that involved hyperextension. Now, patients with objective neurological signs and restrictions of the neck movement were more likely to experience continuing symptoms. So this basically tells us that the research showed that patients who had objective neurological signs as well as restriction of the neck, meaning that when I tap those reflexes, the triceps or the biceps or the brachioradialis or other reflexes, when I went and had them perform certain ranges of motion, these are classical orthopedic ranges of motion. When I did postural studies such as was their spine symmetrical or was it asymmetrical? Did they have a head tilt, a forward tilt, or a backward tilt, a low shoulder or not? Those people who had restrictions in range of motion or neurologically some abnormality, they experienced continuing symptoms. Now, Dr. Jensen is going to talk about spinal stenosis because it is one thing that many people who have whiplash injuries and other back problems will be diagnosed in MRI with spinal stenosis.
Thank you, Dr. Lala. Well, spinal stenosis is actually, there's a narrowing of the spinal canal. And the spinal canal is that there's an opening throughout the back of the vertebrae, or the backbone, as you will. In the back, there's an area of openness that's surrounded by bone, so it's protective. But that canal is only so big. And so with some of the injuries in that, it can cause swelling or some tissue to encroach in that area, therefore causing narrowing of the spinal canal, and therefore can cause pressure against the spinal cord. This can have a lot of deleterious effects, but one of the things that happens with that narrowing is that you could have a loss of the blood supply to the spinal, to those places within the spinal canal. When you look at the discs don't necessarily have their own blood supply, so it's very important that all the tissues around it are getting a good blood supply, because then that then perfuses into the discs, and it's very important for disc health. It can cause degenerative spinal disc disease from a spinal stenosis, as well as sometimes peripheral neuropathy. Peripheral neuropathy is when we look at our peripherals, are our hands, arms, legs, and neuropathy is known as an abnormal sensation that's going to those nerves. So then we can go on with vascular claudication, and claudication is basically saying that the blood flow is not normal in that area, that you're not getting enough blood flow to those areas. And if you're looking at a particular segment of the spinal cord, if it's not getting blood supply there, it normally affects, due to the blood supply, it normally affects 3 segments up above and 3 segments down below. So if you're looking at, say if you have vascular claudication at an area, let's say at T8, which is right in the middle of the gastrointestinal area, T7 actually, you're looking at the gastrointestinal area is around T6 to T9 in the back, which is means the thoracic area. That's the area that your backbone is connected to all the ribs. So right in the middle of that, about the center of the between the shoulder blades on down, that could be gastrointestinal problems, stomach problems, digestive problems. And if you have an area in there that's not getting a good blood supply, it's affecting the whole area. Abnormal aortic aneurysms can form from this, where you have a ballooning in the aorta that's coming out of the heart, that arch that comes down and supplies the blood supply to the trunk and eventually to the entire lower extremities of your body. Peripheral vascular disease can also be a result from that, and that what it's doing is the nerves are causing the vascular system to contract, and therefore not enough blood flow to those areas. Further symptoms of spinal stenosis can be loss of blood supply to the spinal discs, predisposing one to degenerative spinal disc disease, and chronic back and leg pain. As I just said, the discs don't have their own blood supply. It's the blood supply to all the tissues around it, which would vastly affect the discs in a deleterious way. Then we can also find where we have loss of vibratory sensations. So you can't feel vibration from your feet or from your hands. It'll show up as numbness or tingling and broad-based gait. As you've lost that proprioception in there, it's necessary to widen your gait so that you're more steady on your feet. There can be a hunched over gait with your knees flexed and bent. Again, it's not having, if you're in a bus, say, and you're standing, you're one of those passengers that didn't get a seat and you're standing, you find yourself widening your gait, you flex your knees a little bit, and you're a little bit bent over in order to respond to the shifts in the ground. Well, in this case, the ground isn't shifting, it's just that you're not being able to catch all the signals that you used to help keep your standing up straight. And a lot of times, of course, this is aggravated by standing, and that's where you really need that sense of balance in order to stay standing. Dr. Lala.
Well, we're going to take a look at, we've talked about symptoms here. Now we're going to take a look at posture. These are some things that you can have analysis on yourself or have somebody look at the back of you. What you see in this first slide at the far left is if we put a plumb line down a person, their head should be level. The plumb line should go right through their nose, through the center of their chest, right through the center of the symphysis pubis, and through the centers of the feet. If we look at the person from the back, that plumb line should be straight down again. If we see a deviation to the right or to the left, we know that there's some type of curve going on in that spine. Also, if we look at the shoulder, at the head tilt, it should be level. The shoulder should be level. The hips should be level, and so should the knees. When we look at the spine from the side, it's supposed to normally have 3 curvatures: a slight forward sway in the neck, a slight rounding in the mid-back, and a slight sway in the lower back. Now, if we kind of go and look inside of the spine, we see an illustration here. The adult human spine normally has 24 vertebrae, but only has 23 discs. The cervical vertebra, there are 7 of them. That means neck. There are 12 thoracic or dorsal vertebrae in the mid-back. Dr. Jensen has got those there for you. And then in the lower back, there are normally 5 lumbar vertebrae, and then in the center down there is the sacrum. It's a triangular shaped bone that's wedged between the 2 ilium bones. That's ilium. So they comprise the sacroiliac articulation. Now the brain itself, which we're going to look at next, is like the main computer, the main power plant. And it has these various lobes, as we see there: the frontal lobe, the parietal lobe, the temporal lobe, the occipital lobe, and then the cerebellum, which is at the back there of the skull. And then we see that yellow thing coming down there. Looks kind of like a tube. That's called the spinal cord, or the medulla oblongata. So everything starts out in the brain and passes through a hole in the bottom of our skull, that medulla oblongata, called the foramen magnum. And then it goes down through that cervical spine, the thoracic spine, and it ends in the upper lumbar spine. So the brain is like an electrical computer generator. The spinal cord is like the main power line. The spine itself is like the switchboard of the nervous system. Now, if we look at the next illustration, we're looking at the inferior surface of the brain, and we see that it has an abundant blood supply. The blue represents veins, and the red represent arteries. And so if that brain is jarred, just think of it sitting inside of our skull. It has 3 covers that cover it, like sheets on a bed. And if it is jarred, which that usually is when there's been some striking of the head or of the neck or spine, then it's jarred and it can affect all of the cranial nerves. See, we have three nervous systems. We have the cranial nervous system, the peripheral, and the autonomic nervous system, so it can affect those different nervous systems. Now, if we go to the next slide, we'll try and make this a little bit more practical. The cranial nerves themselves, they supply and affect our head, our neck, our eyes, our ears, our sense organs such as taste, smell, hearing, our glands, our blood vessels of the brain itself, our immune response to diseases, bacteria, and viruses that come at us, bone growth, fat metabolism, stress, and brain function. So if in fact a person has problems that have affected their head or their neck, they can therefore have neck pains, head pains, visual problems, hearing problems, loss of their sense organs, their glands are not going to function well, their blood vessels of the brain are going to be adversely affected, as will their immune response to disease, including stress. It will affect adversely bone growth. It will adversely affect metabolism. So what would that tell us? That they would probably have a tendency to increase weight and or increase of their cholesterol. They would be less inclined to normally handle stress and, of course, overall brain function. Now, Dr. Jensen is going to look at what we call the brain in a little bit more detail. It's called the somatic or somatotrophic organization of the cerebellum. Remember, the cerebellum was at the back of the brain, and it is very often one of the areas that is most commonly injured in whiplash-type accidents. So, Dr. Jensen?
That's right, Dr. Lala. Well, as we look at the brain and some of its organization, we're looking at the parietal lobe here, and we're looking at the frontal lobe here, and we're looking at, this is where the cerebellum is. Down in here, this is the temporal lobe. It's usually hearing. Up in here is language. Over here is sensory. When we're looking at this area, it normally is what relates us to the world, our separation from, as well as reaction within. This whole area here is for our judgment and how we react with how we move within the world. And so we're looking at our motor activity from this area, and you can see how much of this area of the brain, how much it's wired to those particular areas. So as we're looking at the movement of the feet, it's this much of an area. The movement of the legs, movement of the buttock or gluteal or the hips, all the way throughout the trunk. And then we look at this, why we have such dexterity with our hands. Look how much of the brain is just about working with the hands. Same over here when we look at sensory. Sensory, we can have very little sensory in the feet and the legs all the way up through the body, relatively less than just how much is really apportioned to just our fingers alone. And our hand is incredible, the amount that we use in there. And of course, we use that to reach forth and touch the world a great deal. So we're looking at how that organization there, somatotropic, means we're looking at the body's organization upon the cerebellum. So that's how basically our brain is organized. Now let's look at how that's organized going out to the body. This is attached to the body by all those nerves that come out, as Dr. Lala was talking about, that it's the spinal cord is like the switchboard to the body, and all these nerves come out through the spine, and they come out there. Here, there's some gatherings that we have where a bunch of nerves come together, and these are called plexuses, and they form the peripheral nerves that go out to the hands and the arms. And then there's a sacral plexus here that goes out to the legs on down. So we have two big gatherings of these for the peripheral nerves. Many times if we have neck injuries, it affects this brachial plexus, and low back injuries, and the musculature around it can affect the lumbar plexus as it goes down. One of the real thick peripheral nerves that comes from that is the sciatic nerve. So we have the lumbar plexus and the sacral plexus here. And they can affect a great deal of things, from genital urinary areas, so we're talking about bowel and bladder movements, as well as function of our sexual and reproductive organs. as well as the lower third of our gastrointestinal section. So that's where the peripheral nerves work off of. Then we look at how we map it across the skin of the body. These are called dermatomes, and we're looking at their cutaneous or skin innervation, and how, if you're looking at the top cervical nerves, they almost form like a hood that comes up over the body. Then you have the cranial nerves that affect the face, that you can tell for the sensation of the face. Then, for the most part, we have the bottom part of the neck, top part of the thoracic area that affects the arms and the hands. And then each of the ribs come out in between each of the ribs. And then we have from the legs how that stretches down, even down to the toes and through. And then the lower part of the sacral nerves just encircle the anus.
And of course, that would be classical that the typical chiropractor, in our opinion, would be checking these dermatomes with either a pinwheel or a brush and tapping the reflexes as well.
You're going to want to check a number of different nerve sensations of it. You're going to want to check whether it's soft, where it checks soft sensation, or a sharp prickling sensation. You're going to want to check how sensitive it is. Like on the fingers, you can tell two needles that are very close together, but on the back it can be that far apart because of that mapping in the brain and how much is attributed to it.
I know we run into people periodically, new patients who were in accidents many years ago and say, well, did you have any chiropractic care? Yeah, I went to the chiropractor. Did he x-ray you? Well, no. Did you have treatment? Yeah. Did it help you? Yeah, a little bit, but I quit, or my insurance said I couldn't go to the chiropractor anymore. So 10, 15 years down the road, sometimes much less, they're having back problems because the chiropractor didn't bother doing a good examination that would substantiate the care and give justification to the insurance company to continue to pay for chiropractic care.
Sure.
And a lot of that stuff continues to go on today, too. When they run off to a massage therapist or a physical therapist, there's not a big diagnostic or an adequate, in many cases, diagnostic workup. The patient is the one who's shortchanged. Massage therapist already got the money, physical therapist already got the money, chiropractors already got the money, but the patient's stuck with the problem because in many cases it looks, if we look backwards, that they were not doing an adequate job at the front end of it.
Right.
So what else do you have there?
Okay, so we're going to look at the next slide. This is also looking at how the nerves, we've looked at it, how it goes off to the peripherals of the body, but now we also have to look at that these nerves also affect all the organs. Specifically those organs. And as we talked about, where Dr. Lala went through what the nerves coming out of the occiput affecting all the sense organs and so forth, as you can see their wiring coming from this area right here. You can see as we go down, and this is truly that switchboard type of model that we were talking about, where along here this affects the heart and the lungs, as well as, and now that wiring comes from both here as well as up in here.
So like it's highly possible that there could be cardiac arrhythmia, the result of a neck problem.
Sure.
Or a neck injury because it affects the blood supply coming in and going from the spine to the heart.
Well, let's look at these two wirings just in the case of the heart. This is the parasympathetic nervous system, which actually slows down the heart. Okay? And this is a sympathetic nervous system, which is that fight or flight, which speeds up the heart. So if you have a subluxation here, it's not, it can be continuing to send a signal here that's telling it to beat fast and raising your blood pressure. Okay? However, you might have a subluxation here that is keeping this from slowing down the heart and therefore lowering the blood pressure. So it could be in both of these areas that you have to check for that. And one of the interesting things that I find is a lot of times our society takes a lot of stimulants. And with that stimulants, I find that they have subluxations here, and in some cases they have them in both places, here and here, due to having too many stimulants.
And that's because you examine them, as opposed to some people don't bother. Lay them down, snap them, and crack them, and get them out the door. What do you have next?
Well, then we're looking at what is a subluxation. Here I'm throwing this term around, and a subluxation is basically a misalignment of the bone, and many times we hear about chiropractors are called bone doctors. Well, it's really, we use the bone to help take the pressure off the nerve. And really, a chiropractor deals mainly with the nerves and with the function of the body that comes from the nerves. So when we look at a subluxation here, we're talking about a bone that's not necessarily dislocated, but it's moved out of place and stuck out of place. And therefore, what we find is that there's these windows, or tunnels, if you will, that the nerves, veins, arteries, lymphatics all come out of here. Well, you have pressure that comes back here. Interestingly enough, the first thing that gets pinched off when this moves back is the vasculature. And the vasculature can affect a couple segments above and a couple segments below, therefore affecting a huge block of the spinal cord. Then what you have is the pressure of basically, if you took a quarter and put it in your hand, that kind of pressure is all the pressure that you need to affect the nerve here. And what will happen is that when you start putting that pressure on there, it'll make the nerve more sensitive. Will have that hair trigger effect.
It could be dangerous then to have somebody working on a back without an x-ray, such as we have next, knowing how that vertebra is out of alignment and how it should be placed back in there correctly, right?
Certainly, certainly. And so we look at, with this next one, we have a scoliosis. And the scoliosis, we're going to look at where we have a disrelationship that occurs in here that you can certainly see, and in here that you can certainly see, and down here that you can certainly see, which is caused by the SIs on these sides also. And now let's look at how it affects, yes, the sacroiliacs. Let's look at how it affects the internal organs. The ribs are spread wide over here, and they're close together over here, which means that the heart on the left side and the lung on this side has less room to function, okay? Then also you're seeing where it's affecting this area in here that has to do with the gastrointestinal. Well, you look underneath the diaphragm here and you see all this marbling along in the intestinal tract here. So you can see that there's a little bit of problems with the gastrointestinal tract throughout
many
this
of these
area.
issues start out in childhood, as our next x-ray show.
It may.
That's why these children's spines should be examined on a regular basis
and this is
by a qualified chiropractor.
This is a very good case where you see a lot of marbling down in that gastrointestinal section. Oop, let's go back. A lot of marbling that takes place in this gastrointestinal tract. And I'm surprised we don't have the x-ray that comes after this on there, because what we see in the after effect is that the spine is much straighter and that this marbling is gone and showing, and invariably we get children who in some cases you have parents and grandparents that come in and thank you, because when the gastrointestinal tract is not working in a child, they're a whole different child. And so next thing you know, when they get through that, they come in and they say, you know what, you returned my child to me. They're acting normal again.
Yeah, a lot of these problems that these children have, growing pains, they write them off, oh, give them a baby aspirin or something like that. It's just absolutely crazy. When they
no such thing as growing pains.
You start that kid on a program to drugs the rest of their lives, and crippling too.
Yes.
So anyway, there's a difference in surgeons, and there's a difference in dentists, there's a difference in chiropractors, there's a big difference. And the only way you can find out if somebody's really bad is look at the respective Board of Examiners' websites. But there's a thing about thoroughness. You can always tell, usually high-pressure, sales-oriented people got great personalities, but usually inside or behind in their practice, they are not very thorough. And your health is your most important asset. It really is. And the better care that you give it, the more that you learn about it, and the more that you relate to qualified professionals such as chiropractors who are very thorough and very conservative in care, the more likely you're going to have better health and good and long life. And you want to go to a chiropractor who is science-based, that's using proper scientific methods to substantiate what they do, and that should be based on proper diagnostic testing, not some Mickey Mouse stuff or voodoo exams and things of that nature. You want to get to good people. So good health to you and long life.
House Call has been brought to you by the Fellowship of the Great Physician. For further